Welcome to Men's Anonymous, the podcast where men can be vulnerable and open without fear of judgment. Your host, Daniel Weinberg, leads authentic and unfiltered discussions that explore the challenges and triumphs of modern manhood. Join us as we break down barriers, challenge stereotypes, and redefine masculinity. Men's Anonymous, a safe space for men to lower their shields and share their inner world without judgment.
Hi, on this week's show we have Josh Ketner from the Dream Body Clinic in Puerto Vallarta, Mexico. We talk everything stem cell therapy, the benefits of, and what it can really do for you. Men's Anonymous. Hey Josh, welcome to the show. Nice to have you.
Thanks for having me, Daniel.
So where are you in the world right now?
I am in Puerto Vallarta, Mexico.
Puerto Vallarta, Mexico. And how long have you been in Puerto Vallarta for?
I moved here in 2008, so what's that, like 17 years? And
Wow.
Never going back. Came down from Seattle and had to get out of the rain and love it.
And so what made you go down there in particular?
Ooh, that's kind of a bit of a story, and it's how I ended up doing this stem cell clinic, is that my dad got Lou Gehrig's disease. That was about 20 years ago. And he is a rocket scientist, had this big aerospace company, super smart guy. But when something like that happens, you realize real quick how messed up the American medical system can be. And with his research at the time, because there's no cure for ALS and it's a muscle wasting disease, I mean, you basically get trapped in your own body. It's horrible.
So explain Lou Gehrig's. Explain the...
Yeah, so they don't know exactly what causes it, but it seems like there's this protein that doesn't bind properly and your muscles just start wasting. So imagine you're this rocket scientist or smart person and you're just stuck in your own body as it deteriorates until you finally just waste away. And it can happen quick or long. You know, like they say Stephen Hawking's had it, but like he lived a really long time, which isn't normal. Usually gets you within a few years. And so he was looking into alternatives and he goes, well, how do they treat other muscle wasting diseases? And he goes, well, if you got HIV, they give you muscle wasting drugs like testosterone, human growth hormone. They throw them at you like you're a bodybuilder. It's crazy. And it works. But for ALS, they wouldn't do that. Up in Seattle, they're like, no, they're like, well, that falls under the Anabolic Steroid Act, is what they said. We're like, he's 50 and dying. It's not like he's going to go play pro ball. Who cares? But they wouldn't let him. It was frustrating. And that kind of got me down this path, caregive for him. I then started working for this caregiving company called A Place for Mom that helps people find like senior housing. Read this article one day. It was like, man outsources parents to India. I was like, yeah, that's genius, you know?
Say that again? Outsource your parents to India.
Yeah. That was the headline of the article. And I thought that was kind of funny because I'm like, that's smart, right? Like people pay a fortune for assisted living. It can be like $5,000-$10,000 a month in the US. And the big problem is it's overregulated. It's usually not that great a care. And the cost is ridiculous, all these things. I go, well, yeah, if you sent mom to India, it'd be great doctors, low cost of care, not overregulated, but who's going to go visit? Yeah, who's going to go visit mom in India, right? So we used to vacation in Mazatlan, Mexico every summer. I was like, Mexico's pretty similar. I wonder if that would work. And I had a friend that had moved here to Puerto Vallarta, and I moved here. Had some big investment groups interested, just never quite worked out. And I met my wife, and her sister's a doctor, and learned I could get certain medications like human growth hormone, testosterone, some of these other things that are great for that and just great for men's health in general. And I started this program because I learned that you could seek medical treatment abroad and return home with 50 dose units of medication. So I started specializing in medicines that were hard to get in like the US, Canada, UK, from Australia, all over the world. And with that, they can come down and we would get them like a year's worth of growth hormone and they could fly back home legally. So
in the US, is growth hormone not readily available?
Pretty much all of the world. Yeah, it's near impossible. The only ways you can really get it is if you're a little kid not growing tall enough. Right. Or if you're an HIV muscle wasting patient, and they're finally doing studies on it, like the TRIM study, TRIIM, just came out, and they gave 10 guys all over 50, 2 IU per day with metformin and DHEA. And after the course of a year using DNA methylation tests, they found they were all a year and a half younger on the DNA methylation test to epigenetic age-wise, which really means 2.5 years because they aged a year in the process. And so we're getting good things. Now they've got a new study. It's showing it regenerates the thymus, which is a little gland behind the sternum, and that produces your T regulatory cells, and it shrinks as you age. So some really great, I mean, celebrities have always known about this. There's a real famous story of like Sylvester Stallone's private plane got raided in Australia when he had some growth hormone. Only Aussie Customs was brave enough to raid Rambo's private jets. But, yeah, and so that's how we got going. And then 9 years ago, you start hearing that they're doing stem cells in Mexico. I knew a bit about it when my dad was sick. We looked into it, and we tracked down a guy who did his PhD like 18 years ago and started working with him, and then got our own thing going. And that's what we've been doing for the past 8 years, is helping people with mesenchymal stem cells.
So I read the book a little while ago. It's called Stem Cell Therapy, A Rising Tide, How Stem Cells Are Disrupting Medicine and Transforming Lives. It's by a guy called Neil Riordan, which I'm sure you're very, very familiar with. It came out in 2017. And I also remember the story around Christopher Reeve, who was Superman in the 80s, who was quadriplegic, I believe, in a wheelchair for many years before he died. And he was not allowed to receive that treatment in the US. And so he writes a lot about this and all the anecdotal evidence around the benefits of stem cell therapy and how it works. I'd love you to maybe explain to the listeners the concept behind stem cell therapy, firstly, and why it's so compelling, and what the health benefits it has, and what particular ailments or conditions it treats. And maybe go into a little bit around what I was always fascinated about the whole process of the harvesting of the stem cells itself, and the difference in quality. So when I read the book that he wrote that I just talked about, he spoke about the different places in the world where you can get the treatment. And he talked about two different categories, which was the actual quality of stem cells, number one, and the quality of practitioners who are administering the stem cells. So he spoke about Panama being very high quality the stem cells, but like places like Switzerland have incredible, practitioners that are treating, etc. So why don't you give us your take and explain, demystify what stem cell therapy is and all the benefits it has.
Okay, well, let's start with Dr. Riordan. You brought him up. I mean, he's the man. He made this all so famous. There was an interview with him on Joe Rogan. Maybe it was like 8 years ago or so, where Mel Gibson brought him on. Like, I don't think Joe even knew he was going to bring him. And the whole episode was just about Dr. Riordan and stem cells, how they helped Mel Gibson. They helped his dad. His dad was like 92, death's door. Mayo Clinic told him he's done. And someone convinced him to send, go down to Panama. But Panama didn't want to treat him at first. And I could understand that. You got this guy that the Mayo Clinic says done. It was like heart failure, kidney failure. Like, it seemed like he was done. And Dr. Riordan didn't want to be the guy, getting said, oh, great, this famous guy's dad comes to me and dies, and it's not my fault. But what do you think they're going to blame? Not the 92-year-old with, organ failure. They're going to blame the stem cells. But Mel convinced him to do it, and they did. And his dad lived like another 10 years, basically, like death's door, recovered. So it was incredible. I mean, you can't get a better testimonial than that, because Mel didn't have to do it. Now you got a lot of clinics that use celebrities and they give them free treatment and stuff and overhype it. And so it's become quite this marketing game, right? There's a lot of good, a lot of bad. And what Riordan's done is incredible. He did his PhD at Case Western University under a man named Dr. Arnold Kaplan. Dr. Kaplan's like the godfather of stem cells because he named them in the early 90s. And we actually got
US? that what's done in the
Yeah,
US?
yeah,
Right.
he was professor of the Skeletal Muscle Institute at Case Western University in Ohio. Fortunately, he passed away about a year ago, but before that, we got to work with him also. So that's how I know we do the same thing as they do in Panama. There's one in Colombia that I know, like he had indirectly advised through one of his advisors, and so there's like three of us that all kind of had that direct tie with Kaplan doing it right because the quality does matter, right? There's like
Well,
I'm
the
in
quality of the
Mexico.
actual stem cells you're talking about.
Yes, yes, and so there's a lot of ways you could go with that, and it's really the big advantage here in like Mexico and Colombia and Panama, maybe like I think the Cayman Islands or some, and Costa Rica, is that we're allowed to isolate the stem cells and then culture them, and that means replicate them. In the United States, you're not allowed to do that. You can do stem cell therapies, mesenchymal stem cells, but you can't have pure isolated or cultured, meaning replicated stem cells. And it's because of two really dumb laws. You've got first, there's a rule for minimal manipulation. So are you familiar with like platelet rich plasma, PRP?
I think you should explain it all for like,
Yeah, okay.
imagine
So
we are 10-year-olds.
okay,
Explain everything.
perfect. So PRP, platelet rich plasma, is we take some blood, we put it in a centrifuge, we spin it, and you're gonna have this vial where the bottom half is red blood cells, the top part is this like kind of yellowish clear liquid, and that's your plasma. You dip a needle in, you take out the plasma near the red blood cells, but you don't get the red blood cells, and that's called platelet rich plasma. This is already in your bloodstream, but it's loaded with growth factors like IGF-1, IGF-2, VEGF. There's like 8 cytokines, 8 growth factors. These things help
IGF,
heal.
I've heard about because they use it as peptides. Is that right?
Yeah, yeah, and that's growth hormone converts into IGF-1. It's great for
Right.
healing, right? But it can't get past scar tissue, and we'll get to why that's an issue in just a little bit. So PRP has been legal for a long time. You can do it, but it's a minimal manipulation. So therefore, it's not a medication, it's a treatment. And that's kind of where these like gray areas start to show up. And so with the stem cells in the US, they can do either a liposuction, and the patient's awake. It's pretty brutal. And they take out a bunch of fat, put it in a centrifuge, spin it, and then you've got this liquid. You can do the same thing with bone marrow. But the problem with these two techniques is that less than 1% of that liquid you're taking is mesenchymal stem cells. So
And
Dr.
what does that mean?
Kaplan,
What
the
does that
stem
mean?
cells that we use.
So
So
you're
you've
saying
got
that
this.
you're saying the powerful, the stem cells that have the most impact in the therapy.
Yeah, the mesenchymal stem cells because you can't fully isolate them. So they'll call it a stem cell therapy in the US, but it's really not. Dr. Kaplan would get really mad at these clinics. He'd be like, "Look, that's no different than Coca-Cola selling you an apple juice saying it's all natural, and then you read the back label and it's 99% sugar and water." It's the
Mm.
exact same thing with these stem cell therapies in the US, is that they're not allowed to fully isolate the cells like we can do here. They can use an umbilical cord like we can. And the reason they can use these tissues is, I guess we got to go to what a mesenchymal stem cell is. It's technically a pericyte. And a pericyte is this little like cell that lives on the out, pretend my arm's like a capillary. They live on the outside of those tubes and they look like little octopuses hanging on. And they squeeze, release, they control blood pressure. But they also, if you're injured, say my elbow hurt, they're going to come off, they're going to go to that area, and they're going to start guiding the repair. So in your body, they're not really a stem cell. So Dr. Kaplan was playing with these cells in the lab, and he found if he added certain things, he could turn them into other cell types. He could turn them into adipocytes. Those are the building blocks of fat. Chondrocytes, the building blocks of cartilage. There's like 4 or 5 others, but building blocks of tissues. There's only like 5 or 6 cells they can turn into. But in your body, they don't do that actually. They stay as like the manager and they work via these signals they send out. So they get to the area that's damaged and they start sending signals to guide the repair process. And that's great, but when we hit bone maturity, which is age 18 for women or 21 for men, you lose 90% of your capillaries because you're not growing taller. You don't need all that extra blood flow. And so now the problem is you just lost 90% of your mesenchymal stem cells. So if you get hurt, your white blood cells are going to rush in first and they're going to do a patch up job with fibrosis. And that's a problem because once the fibrosis, the scar tissue set in, that blood, like the PRP that we were talking about, that plasma, all those growth factors, they can't get past that scar tissue. So like IGF-1 is awesome. PRP is awesome. If say I hurt my elbow today, if I got that in like within a couple days, man, it would heal right up because you got all the growth factors before the white blood cells rushed in. But that almost never happens. I mean, it's really dumb. Like everywhere in the world, they should just have centrifuges and little like PRP clinics all over just to right when you get hurt, shoot it up. But they don't do that.
You're saying like you fall off your bike. Like I one of my closest mates, he had a bike accident, got taken out, and his knee got completely destroyed. Full operation with 18-month recovery. And are you suggesting that if he would have been treated within the first 48 hours with this therapy, that the recovery would be completely different?
With PRP, yes. That would have been his own blood plasma in concentration there. Very high chance he would have healed up just fine. But the problem is your white blood cells get to work and they patch it up. So now you're stuck with that scar tissue. And this is why the mesenchymal stem cells we use are so important, because I dumped my dirt bike last year, 50% tear of my tricep tendon.
Oh, wow.
It was really bad. And, I tried to let it heal up. It was going okay. And it didn't tear right away, but I kept working out, being an idiot, pushing it too far. And I woke up in the middle of the night, like a month later, and it felt like someone stabbed me. I mean, it was bad. And so then I had to go get the stem cells, and I did that, and we've completely healed it with the stem cells, but I also didn't take care of it right away, which I should have done. I know better.
Why didn't you? You're the expert. Why didn't you do what you're suggesting?
Because I don't know, you should listen to your own advice, I guess, and you don't always do that. So I just thought it was going to heal up. I didn't think it was that big a deal. I've hurt myself before, but it was the continued to work out, and I made it worse. I mean, it was just stupid. Pushed it too hard. You should always let it heal and rest, but I didn't. And so with stem cells in there, they can get rid of that scar tissue, then start guiding the repair of that tissue. So that's really what they do. Think of them like the manager on the construction site. Like Dr. Kaplan wished he could have renamed them medicinal signaling cells, but the mesenchymal stem cell name is stuck and it doesn't properly describe them. So now people get confused because they start thinking of those embryonic stem cells that can turn into any kind of cell that were supposed to be like the magic, fix everything. But it turns out those don't work because they want to become a baby. And so they spent so much money, time, and effort doing research on that. And they always found it wanted to become a baby, typically became teratomas. So mesenchymal stem cells don't do that. So there's no risk, and they're just a better option.
Can you explain the process of the harvesting of stem cells? So I'm going to come to you.
Yeah.
As I said before, so I had a back operation 5 years ago, and I researched stem cell therapy. I was actually booked in to go to Panama, but personal circumstances popped up and prevented me from going.
Sure.
My recovery's been good anyway, but what I wanted to ask you is, if I come, let's say I've got a problem like my back issue, the stem cells, the treatment itself, the stem cells that you're going to be putting into let's say my back area, where do they come from? Where do the original stem cells come from? And how do you assess or determine the quality of those stem cells when they speak about, oh, these are really good quality stem cells? What makes them high quality stem cells?
Great. So first, what I always like to point out to people is Dr. Kaplan would start every conference with this phrase. He'd say an MSC is an MSC is an MSC. So mesenchymal stem cell is an MSC is an MSC. What he meant by that is like, there's this big marketing game that like fat derived is better than, say, umbilical cord, or is better than bone marrow. They all work the same way. There's some minute differences, but they all work the same way. So now you got to decide which tissue is best for what you're doing. So when we first got going, we had already the umbilical cord cells, but we also looked into doing the fat derived.
Hey, can I just stop you
So
there? With the
yeah,
umbilical cells, who's umbilical? Like
okay.
where are you getting these umbilicals from?
Perfect. Okay, we'll just jump into that then. We use umbilical cord because it's the youngest, healthiest source. It's only 9 months old, so it hasn't had a long enough exposure to an immune system to develop any bad habits because these work really well for immunomodulation. They can fix a lot of autoimmune diseases, and that's because of how they interact with the immune system. So you want from a young, healthy donor that doesn't have any health issues. So we take them from women. We have very stringent criteria. They have to be between the ages of 18 and 25. They have to be first time mothers. They have to be married. We ask them how many sexual partners because a mesenchymal stem cell can't carry a virus. But if the donor had a retrovirus, there's a less than 5% chance that could get passed over. And almost all retroviruses are sexually transmitted. So we're really limiting that right there. We even take it a step further, and there's a federal database here of anyone that got the COVID vaccine. So anyone that had those, if we rule them out too, just
Oh,
because a lot
wow.
of our patients don't want anything to do with that. So we take it as far as we can. So younger women have healthier births. First time mothers have the best births. And it's crazy, but if a woman has birth after the age of 30, that's technically a geriatric birth. It sounds horrible, but yeah.
Yeah.
So young women heal faster, give better pregnancies. So we work with a team of gynecologists that only take from this select group, and we only need a new umbilical cord maybe every 2 or 3 months. We get a lot of cells from them because we stagger the cultures. So every day we've got fresh stem cells coming out. Now we can take these from donors and not from the patient because of what's called HLA. That's human leukocyte antigen. That's a marker that all of your organs have and most of your cells that tell you it's yours. So if you needed a kidney and I'm a perfect match and I'm willing to give you a kidney, you're going to have to take immunosuppressants the rest of your life to keep your body from rejecting that because your HLA and my HLA are different. Everyone's are. So that's a unique marker. Mesenchymal stem cells are considered immune privileged in the sense that they don't exhibit HLA. So your body can't tell that these are from someone else. They just get in there. Your body all of a sudden feels like it's 18 years old again because it's got a bunch more MSCs like it did when you were young. And you basically allows you to heal like you did when you were a kid. So we now take it a step further. We take that umbilical cord. It has to get to the lab within a couple of hours. So we have to take them locally and get them right there. And we start processing. You're dissecting it up. You're putting it into these big test tubes with what's called collagenase, centrifuging to separate the cells from the tissue, shaker tables. Then you get it to what are called the flasks, and they look like this see-through plastic flask, and you put it in there with what's called a culturing medium. This is the food that these cells are going to eat while they replicate. And you put it in the incubator, which is like this specialized oven, keeps it at a perfect temperature, perfect oxygen levels, perfect CO2 levels. We control the environment. So it's like the Garden of Eden for these cells. They got all the food they need. They're at the right, we put them at a really low oxygen environment. That stresses them a little, but it replicates the stress they're going to be under in the human body. So we want to keep that pretty level. And so these are the little things that matter on quality. You need a young, healthy donor. You need to make sure that your incubators have these right settings. You can just replicate these. You have to have crazy air filtration. I mean, we're ISO rated. We're like one step above like aerospace. Only aerospace goes like higher or lower ISO ratings than like what we're doing. So you have to have a very clean, sterile environment. I mean, it costs millions to build a lab to do this. So it's a very, very good facility, but you can also do it in a very unsterile environment. And unfortunately, in places like Mexico and other countries, there's a lot of people that do that. So the quality comes down to the lab, who you have doing it, where you're getting it. Just the quality control is the biggest thing. And that's why places like Dr. Riordan in Panama does such great work and why we do such great work. And there's international organizations that, are able to set these precedents, like the International Stem Cell Association has guidelines for what is a mesenchymal stem cell. So you follow these standards and if you have to do it above that. So we even do like the women, because we want to make sure they don't have any issues. We test them for everything. Then we test the tissue. Then we test the isolated stem cells. Then we test the cultured stem cells. And then we give that to a third party lab to analyze and give all of our patients that analysis from their batch so they know they're getting perfect, sterile, clean, exactly what they're asking for, and all of that. So that's how
Okay, so
we ensure.
I've got a lot of questions, a lot.
Sure.
So one stem cell from one very healthy first-time mother will provide X amount of stem cells. How many people can be treated from one umbilical cord donation, let's say?
Well, but see that's tough to answer because how many treatments is the person doing? Like,
Let's say how many
you know,
treatments? How many
you
treatments can
might,
you?
yeah.
No, you're right. So how
So,
many treatments can you do per umbilical cord extraction?
well, the thing is there too is every treatment has different cell amounts, all of that. So we typically treat anywhere between 120 to 150 patients per month. And it's usually about every 2 to 3 months that we're getting a new umbilical cord.
Oh,
So
it's like
you get a lot.
about
And
400, 450,
yeah,
basically
you get a lot of
400.
people. Yeah.
That's insane.
So yeah, so you get
What's
you
the
start in
motivation? What's the motivation for the mother to give over the umbilical cord?
nothing. I mean, this tissue gets thrown away otherwise. You can't pay for it because then you'd be like, like buying and selling human tissue, very illegal.
Hmm.
So we just ask, would you be willing to donate this? They get a bunch of extra free testing and different things, and they know our gynecologists are going to take extra special care of them. So it's beneficial for everyone, but it gets thrown away otherwise. Most of them are just happy to help other people.
Okay, so tell me which treatments you have observed. You do an array of treatments. You're treating different,
Yeah,
let's say, different conditions. Can you maybe give us some anecdotal stories of, let's say, specific cases? What was
sure.
treated? How many treatments? And what was the end result? Because I remember reading in the book some really like sounded like science fiction stories, to be honest. So
Yeah.
maybe tell us some of those very
Yeah, sure. And
specific.
the good part is I'll tell you the stories, but if you go to my YouTube channel, you can see the patients themselves tell them. We have tons of testimonials. My favorite one
Yeah.
is this guy comes in. I'm in this like business entrepreneur group I was in years ago, and this guy sends his buddy. And the guy comes in, he's like, "Hey, I'm Brian." He sits down, he's like kind of big, heavy set guy, and he's like, "Josh, you know what I do for a living, right?" "No, what do you do?" He goes, "I sue stem cell companies." "Oh, great!" Like, yeah, like, then this better work. So he's this big time attorney up in the US. And I mean, there's been a lot. It's funny, people worry about going to Mexico and other countries for like quality and, safety and all that. And pretty much every horror story, medicine wise and with stem cells, has all happened in the United States. There have been some really shady operations there that have hurt people. And this guy was the attorney that won all those cases, never lost a case, went after a lot of these. And he had had asthma or bronchitis. Yeah, it was bronchitis since he was like a little kid. And he did our IV treatment. And when you do an IV, it goes to your heart, then your lungs. And, we fixed like something like 40 years this guy had been dealing with bronchitis, and we cleared it up with just a simple IV treatment. And it's my favorite testimonial
One
because he
one
starts
treatment.
it.
One
Yeah,
treatment.
one treatment. Yeah, we did, I think, 300 million stem cells in the IV, and it goes to the heart, then the lungs. A lot of them dissipate into the lungs, and it just cleared everything up and got him doing great. So that was a really cool one. And then for heart failure, we've seen unreal results, like patients with their ejection fraction down to like 30% that, we do treatment, go straight to the heart. They're so effective. Studies up until 2014 thought they were becoming heart cells. They're not. They're just guiding the repair, but we're consistently fixing people with congestive heart failure or damage after heart attacks, and it's getting their numbers back up to normal, which you're not supposed to be able to do. We're seeing, I'd say, knee treatments are our most common treatment. Lower backs is number two.
So for,
And
for knee treatment, what does it do exactly?
well, we put it into the knee. Like me, I had multiple meniscus tears and a partially torn ACL. I was patient number one. I've done every treatment we offer, just about. I think maybe only one or two I haven't, that I just because I didn't need them. But yeah, it got in there, and they seek out inflammation and guide the repair. So they fixed up my meniscus, fixed up my ACL. I have the before and after MRIs to prove it. And I did a new MRI last year because my kneecap was hurting, but on the same knee. But it was I had some new arthritis from riding my bike too much, but the ACL and meniscus are still perfect. And it's almost 8 years later. So the cool part is it's real regeneration. It's not just a cover up. And we're consistently seeing arthritis, which you're not supposed to be able to fix, like cartilage regrowing. And
So
it's
yeah,
been
so
really
my
cool.
father is 78. He was a runner for, I mean, my entire childhood. He literally ran every day, did
Mhm.
marathons, etc. He has had knee procedures. He now has zero cartilage in either knee,
Got
and
it.
and yeah,
Mm.
I mean, he's still a fit guy, but he cannot run anymore.
Yeah.
Walking pains him because it's bone on bone.
Yeah.
If I was to send him to your clinic, what would the stem cell treatment do for him?
Well, that gets tougher, right? Like stage one, stage two arthritis is usually one and done. Most of the time, I'd say 80% of the people, one and done. 15% get improvement, but not like 100%. And there's a 5% that are just non-responders, right? It's medicine. You don't have a 100% batting average. It's not possible. But when we start looking at stage three or stage four arthritis, like real bone on bone, we'd have to see an MRI. We always start with an MRI. We have our own MRI machine here on site. We do an MRI for any joint treatment we do. It's included with our treatments. We would do an MRI, and if there's absolutely no cartilage, it's probably not worth doing because the stem cells need something to build upon. So, but if
Right.
there's even a little there, I've had patients with fourth degree get to third degree, best case second degree, but it's more difficult and it's like a much lower success rate. I would say, it's probably more like 60% of those people are getting improvement. Maybe they'll get to, third or second, or even just kind of stay the same with less inflammation. You're probably going to have about like 20% of those people are going to, you see a little more improvement than that, and 20% aren't going to respond. It gets more difficult, and we always give realistic expectations. The longer you wait, the tougher it gets. That's just what it is. It's more tissue to fix. So, but you can always do more than one treatment. We've had people that were bone on bone. Like I've got a great example. This lady's a firefighter that was fourth degree in both knees. They were going to medically retire her. And we got one knee to third degree, the other to second. It saved her career. She came back a year later, did it again, continued to improve, and we've kept her working. So I mean, it's even saved careers, which is pretty cool.
Okay, so I'm 50 years old. I'm a relatively fit, strong man.
Sure.
And if I was to come and do a treatment just, okay, with no specific ailment,
Hmm.
what would it do for me? So I don't have
Yeah.
a knee condition, a heart condition, thank God,
Great.
none of those things at this moment in time. So as a healthy man or human,
Hmm.
what would it do for me?
Well, in a case like that, we'd recommend an IV. So an IV isn't going to fix a knee or a shoulder because cartilage, ligaments, tendons, they get little to no blood flow. So an IV isn't, you get people calling asking, hey, do I just do an IV and it'll fix everything? Well, it's great for organs. It's great for like blood flow. It's great for that. So when you do an IV, there's the cool benefits on the anti-aging side are that it seeks out inflammation. So it reduces that, usually not a big deal, but almost every major disease starts with inflammation. So you're getting to that root cause. And it does some cool stuff. It does a triage of the cells it comes in contact with in your body. And it goes, all right, you're going to die no matter what, leave you alone. You're healthy. You could use some more juice. And they attach these things that are called tunneling nanotubes. And with that, they can donate their mitochondria to it. And the mitochondria, that's what produces your ATP. That's your energy. So you're taking this cell that was running low on gas and you're filling the tank back up. So that cell is going to live a longer, healthier life, which should mean that you do also. And they've also found like the telomere length. That's the tail of the cell, right? It's like this DNA double helix at the end. It got the rungs to the ladder. Every time a cell replicates, you lose a rung. And you have what's called the Hayflick limit, which means you only get about 50 to 60 replications per cell, which means mathematically, they've done the math on this, you can really only live as a human about 125 years before you're out of telomeres. And when the telomeres run out, the cell doesn't die, it becomes senescent. A senescent cell is like, they call them zombie cells. And they go through your body and they start turning other cells into zombie cells. They attack them, and it's this cascading effect that more and more damage. So the mesenchymal stem cells do a great job of eliminating any senescent cells in your body by telling the immune system to kill them. And they help prevent it from happening by, they've proven there's at least 6 types of cells they extend telomere length on. They think it does it for more, but it's very tough to measure these sort of things, and there just hasn't been enough research. But what we are seeing, and I've got a great video on this, is that it seems to have a huge effect on epigenetic age versus your real age. And they're measuring that now with what are called DNA methylation tests.
That's like your cell age. So they say, oh, you're 50, but if we take your biological age, you're actually like a 42-year-old, something like that, right?
Yeah, and so I got this great video. This lady's 62, her husband's 70. She's come to us every year for the past 5 years and done the 100 million IV. And her husband's done his knees, but nothing else. And they both went and did one of those DNA methylation tests, and her age came out at 27, his came out at 85. So, I mean, huge. I mean, it's crazy. Now, it sucks because we don't have a before treatment to after on that one. We're working with the lab now. We're going to start doing some of those tests. But I mean, for the few patients that have done these tests, all of them on the biological age are much younger than their real age. So it's been pretty cool to see.
So we've heard about a lot of the benefits. Can you please elaborate on what the risks are in doing this treatment? Is it for free, or are there risks involved?
There's really not. I mean, in IV, you could get a mild fever, and it's because you're getting a lot of something new in your system. So your immune system flares up, but then it doesn't see the HLA markers like we talked about, and it just backs down. So you take a Tylenol, goes away. I mean, I do an IV maybe every 4 or 6 months. I mean, why wouldn't I? I'm here, I got it. Like, you know, I figure if I look the same in like 10 years, then that's all the marketing I need, right? But so that's the worst case there, real simple. With a joint, yeah, it's like any injection. You can end up with a little bit of like pain, stiffness, but it goes away. With any type of needle-based procedure, there's risk of infection. We've never had an infection. Again, we check all the cells for anything that could cause an infection. We third-party lab test it, and then we're very sterile in our facility. And we have our own hospital here. You can't really tell seeing, but there's a walkthrough of it on the treatment page. But we've got, it must be like 10 or 12,000 square foot like hospital here, basically, and helping people out.
So if I come down to do a treatment, how long do I, like, Puerto Vallarta, it's a very exotic place for most people around the world. So you turn up, how much time do I actually need on the ground with you? Talk us through the actual process.
So if the treatment doesn't require an MRI, it's like an IV or, you know, more cosmetic type issue, then it's a 4-day trip. Day 1, arrive and rest. Day 2, we do blood work. That's when we take payment, like no deposits, anything. We don't take payment till you're here because we have to take the cells out of cultivation that evening. We always administer within 24 hours of taking them out. Day 3, that's treatment. And then you could fly home day 4. I mean, there's no real downtime to these treatments. It's not like you're going to have to rest anything. If we were doing a knee, like a joint or something, we need to add an extra day because day 1's arrive and rest. Day 2, we're doing blood work. We're doing MRIs. Day 3, we're sitting with the doctor and reviewing it. And this is something we really pride ourselves on. This is why we're not trying to be the biggest clinic in the world. We really care about patient care. I hated going with my dad to these doctors in the US. You get 5 minutes, they explain nothing, they're kicking you out the door. We don't do that. You're going to sit with the doctor as long as it takes. They're going to walk you through your blood work line by line. They're going to show you image by image. You'll understand what's going on by the time you're done. That usually takes, I don't know, half an hour, an hour. Then payment, then day 4's treatment. day 5, you fly home. So it's 4 or 5 days. There's certain treatments for like lung conditions. You might need to be here for a week. There's a few extra things we do, but it's usually pretty quick like that. We've got 8 drivers. Every one of them has a brand new Ford Expedition. They pick you up at the airport, take you to your hotel, take you to the clinic. We don't provide flights or hotel. That's up to the patient. Like
Sure.
Panama, they're in this big tower. They've got a hotel there. It's all included. Puerto Vallarta is like this big tourist town. And we get patients. One guy wants like the Hampton Inn down the road. The other wants the Four Seasons. And we have all of that here. So we let people kind of pick their hotel so they get what they want. And then we provide the transportation.
So big question, cost of treatment. How affordable is this for people?
Well, compared to Panama, it's a fraction of the cost and way more cells. All of our prices are on the website because nothing drives me crazier than going to a website and I can't find the price. Like you've already lost me at that point, so I don't want to do that to other people. So if you go and you look like, say, pretty much any joint, like a knee, an elbow, a shoulder, we use the same amount of cells, usually 50 million. It's like $3,300. If you've got a back problem, the back is in 3 sections. You've got the lumbar, thoracic, cervical. Each one of those is a separate treatment because it's highly focused. And we do like 100 million cells, say in the lower back, plus 100 million IV. That's 8,250. An IV, like 100 million IVs, 3,850. If you're doing a 300 million IV, because we treat a lot of autoimmune diseases and organ-based issues, those we usually recommend doing at least 1.4 million per pound of body weight. So we start looking, most people, that's going to be 200 or 300 million stem cells. And this is different than some of the others. Like if you go to Panama, I think they do 40 million over the course of 3 days. We don't do it like that. We've found it's kind of this parabolic curve that starts to flatten out at the top. And 1.4 million per pound of body weight is sort of the peak of that curve before diminishing returns. So if I did 300 million for, say, MS, like doing 600 million isn't going to give me double the results. So you start hitting these like peak curves. Yeah. And like with the joints, we can put 50 million in a shoulder and knee, and we don't do more because we found if we even go like 75 or 100, you end up, the cells send out pro-inflammatory markers too. So if you put too many cells in, it can really get the joint really stiff, painful for a few days. It's not a bad thing, but it's not fun for the patient. So we found that at 50, right there is sort of the peak without causing any extra side effects and still getting like really great benefits.
Okay. Now, so just so everyone knows, because I think it's super interesting, and I think if anyone has any serious issues that they have not been able to successfully deal with, it's called the Dream Body Clinic. That's correct?
Yep, it's the website's dreambody.clinic, and we do free consultations. Like if you've got a recent MRI or scan, you just email it to me. Our doctors will review it, and we'll be straight with you. We'll tell you if we can help or not. We turn down a lot of people, and that's because, look, we're not going to try and fix something we can't. I've found that bad news travels much quicker than good, so if you try to fix people that couldn't have been helped, like you're going to hear about it. It's not good for them. It's not good for us. So we're very straightforward with people with what we can and can't do.
And to finish off, why don't you tell us a little bit about your book?
Oh, yeah. So I think that's how we got connected. Was Doug was our publisher, and we wrote that. It's just called The Ultimate Guide to Stem Cell Therapy. You can get it on Amazon. Look, it's not the most, it's not technical at all. I did that on purpose. It pretty much gives you an overview just like we did here. It gives you a lot of those success stories that you can watch on our YouTube channel. But, some people prefer to learn via book, some video, some audio. So we try to do a little bit of everything. And yeah, we got that now.
Josh, thank you so much for coming on the show. Super interesting stuff. I think I'm going to come visit you. I think I might even bring a few mates of mine that could benefit greatly from the treatments. So thank you so much. Really appreciate it. And we'll talk soon.
Thank you.
Thank you.
That's it for this episode of Men's Anonymous. Thank you for listening. For more information on the Men's Anonymous podcast, including resources discussed in the show, visit mensanonymous.com. Join us next time as host Daniel Weinberg provides a non-judgmental space for men to voice their innermost feelings and thoughts.